Hello. So in this video, I want to talk about how to stop and reverse the anxiety spiral. Stay tuned. Welcome to Wellness with John. I'm John Peters, and these are resources to help you thrive. So in this video, I want to talk about anxiety, and I want to talk about the anxiety spiral and how you can stop it and reverse it. And this is important information to know regardless of what type of anxiety you have. It's also important for any type of process that you are engaged in to try to address your anxiety. And what I mean by any process is people often go to therapy, people journal, people read self help books, people get pastoral counseling, people get medication from their doctor, people pursue wellness programs. But what I'm going to teach you in this video is what, in my mind, and I'll explain why, is an essential ingredient in your care plan to get the most effective result. Okay. So, first, let me talk about what I mean when I'm talking about anxiety, because there are many different things that we mean when we talk about anxiety. Sometimes we're just generally talking about the subjective state of being anxious. Sometimes we dive into it. And if you've been involved in psychiatric care or counseling, you may have a specific diagnosis. But I'm really speaking broadly to everybody. As human beings, we're all wired to be anxious, and this is an artifact of how evolution wired us. And regardless of whether you have generalized anxiety, where you get anxious about pretty much anything, or you have PTSD, or you have some version of OCD, right, or a phobia, this is true because underlying all of the different types of presentations of anxiety, we all have a fundamental anxiety system. We have a stress response. And what happens is that we get into an anxiety spiral because something triggers us and the anxious response occurs. And the important thing that I'm focusing on here is within that anxious response, certain changes happen, not just bodily changes like our blood pressure going up and our heart rate going up, but brain changes occur as well. So our actual brain goes into a different state when we are more anxious, right? And we spiral because as those brain changes happen, they change what we're perceiving, they change what we're focused on, they change how we process what we're perceiving and focused on, they change our responses to all of that. And that can lead to a spiral because it's a feedback loop, because it may result in more negative thinking. It may result in less effective coping in how we're responding to whatever the issue is. And that makes us more anxious, right? So we're in a worse state because of how we're perceiving things and responding to things than when the whole thing started. That's why it spirals. But even beyond thinking about the anxiety spiral as a process that occurs within one moment, one event of getting anxious, I think that overall, people get into an anxiety spiral when they're having a chronic, episodic, but ongoing syndrome of anxious reaction. And often, when people get motivated enough to go to therapy to try to address their anxiety, it's when they have been spiraling for a while. So we're not concerned here with just focusing on one particular trigger and one particular response to that moment. But we're talking about the anxiety spiral as anxiety progresses, evolves, and unfolds in a person's life, and often becomes more subjectively miserable and potentially more debilitating in terms of functionality or limiting in terms of behaviors and the freedom to enjoy life, whatever that means. So this longer term spiral is where the anxious reaction is basically happening too much to too strong a degree. And it starts to actually interfere not only with coping in a particular moment and not only making a person highly subjectively miserable in particular moments, but overall, it's kind of pointing the person in a direction of overall poorer functioning and poorer coping, right? So basically, anxiety can get worse over time when those changes that are occurring within our brain are happening too frequently and too high a degree, right? Now, let me talk about this from another angle to make this make sense. Um, I've had patients come to me where they're insightful about issues that are going on, triggers that are going on in their life, things that they want to do to try to improve their effective coping with whatever the substantive issues are. And they start engaging in the therapy process, but within the sessions, their anxiety level is potentially interfering for their ability to be present and to benefit maximally from the actual session. And in between sessions, the things that they're trying to glean and take out of the therapeutic process, life happens in between therapy sessions, not just in therapy, right? So people want their lives to get better. That's why they're going to therapy. But often I see patients' attempts to improve how they cope with things outside of the therapy, not getting traction as optimally as they really want, partly because they're remaining too anxious too much of the time, right? Now, let me pause for a second and take a little detour and say there are things that help with that that aren't what you're doing in the therapy session. So, for example, there are wellness practices that tend to lend to better general lowered anxiety, right? Getting good sleep, keeping alcohol intake low, keeping stimulants like caffeine intake low, getting regular exercise. Those are some things, limiting social media, limiting screen time, limiting phone use. All of those things are going to help you no matter what your situation and what your anxiety level is. And especially if you are having acute anxiety and problematic anxiety, you should think about your wellness plan and make sure that you're not running interference for yourself by, for example, drinking a pot of coffee every day while also trying to not have panic attacks, right? So, wellness foundational kinds of practices actually matter to make sure you have the opportunity to lower anxiety, right? But even if you're doing all those things and you're anxious, you need to lower your daily baseline anxiety scores, your daily baseline stress score, right? And what I mean by that is if we think about code green, code yellow, code orange, code red as just some rough ways to think about low medium and high levels of subjective stress. You need to not be flying up at code red any more than you really have to. All right. Because the ability of your brain to benefit from things like journaling, self help, therapy, pastoral counseling, contemplation, the ability of your brain to benefit from those is correlated to what your baseline average score is in terms of your stress level. So, put more simply, if you're flying at high orange or into the code red all day, every day, you actually won't get as much benefit from talk therapy and journaling and all those types of things. And why is that true? Because those brain changes that occur when you're up at code red or code orange, they actually change your ability to process, right? And so, this is uh, a confounding issue, and it slows a lot of people on getting traction on changing their anxiety because the brain is basically working against them. And so what can we do about that? We can lower the daily baseline anxiety level so that your natural coping works better, your natural insights and the things you contemplate on your own or that you work through journaling and therapy, those work better for you because you know this. You can probably think of a recent example if you have chronic anxiety of how in the moment when you're super anxious, so you're up at 11 on the scale of 1 to 10 in terms of anxiety, and in that moment the color of your thoughts is pretty negative. That's just how it works, right? And you've probably had the experience of calming down after getting triggered and spiking up to a high level and noticing that, okay, now I can think more clearly, now I can focus, now I can think more positively and constructively about the thing I'm trying to deal with, whatever the situation might be. Right. So within the time period when your brain is changing over into high stress mode, you actually can't think as clearly. You can't focus as well. You can't benefit and synthesize whatever you're contemplating and how you're trying to think through a situation. Right. That's why we have to count to 10 and calm down, or whatever it is we do, go walk around the block and get away from a situation. We have to get out of the acute stress in order to think clearly and have good brain power to be able to cope with the stress and to respond to the stress, but also to be able to synthesize our overall working with the issues in order to change how we are responding to the triggers of our anxiety, right? And again, what I'm talking about is true no matter what type of anxiety you have and whether it's mild, moderate, or severe. This is just how it works, right? Your ability to benefit from whatever process you're doing is going to be better if your baseline average daily score of anxiety is lower, right? Now, you may be saying, that's great, John, but there's no magic button I can hit to make that score lower. I tried to do what I can do to lower my stress, and I'm just stressed. So I'm kind of stuck and I don't see what I can do about that. Some people get out of that through medication. So, a common treatment that doctors offer for people who have anxiety is the class of antidepressants called SSRIs, selective serotonin reuptake inhibitors. Common ones are Paxil, Prozac, Zoloft, sertraline. And so a lot of people take those because those often will take, let's say 10%, 15%, 20% of the edge off of their anxiety, which means if they were flying along at code orange, now they're flying along at code yellow as a baseline. And that amount of change of the average daily score puts them into a better position in terms of brain functioning in order for whatever they're doing to try to improve it to actually work better. Therapy, journaling, self help, contemplation, natural coping, things like that. All of that just works better if you lower the score. Now, not everybody responds the same way to the SSRIs. Not everybody chooses to talk to their doctor and get an SSRI. And I'm not arguing that that's the magic button because it just doesn't work for everybody and not everybody wants to utilize that. But I am going to tell you about a magic button because I've been a therapist now for 27 years. I've worked with thousands of patients and I have worked with countless anxious patients as a therapist to try to help people not only cope well with whatever is making them anxious, but also to actually lower their general anxious state so they're less miserable and that they function better. And there's a technique that I teach my patients that I think is essential for getting the maximum type of positive change when someone is wanting to be less anxious. And why do I say this? Because I've taught it to a lot of people. And more specifically, when I teach it to people and they actually practice it, I see this type of change, right? So, for example, I had a recent patient who was anxious, and I told them the things that I'm sharing with you in this video. And like a lot of patients, they didn't take me seriously. And this is just the way therapy goes. lots of stuff I say, people either like or don't like, and either practice or they don't practice. I don't have control over my patients. But like a lot of my patients, this person that I'm thinking about in this case example, he was doing the therapy. He was having insightful and meaningful discussions in the therapy. He was doing a variety of wellness things, but his anxiety wasn't getting a lot better. And I was gently reminding him to do this technique that I'm going to explain to you here in a minute. And he didn't take it real seriously until, I don't know, 3, 4 weeks into the process. And then finally he came back in a therapy session and he said, okay, I'm a lot less anxious this week. And I said, well, what'd you do differently? And he said, well, I actually was doing a lot of the same things I've been doing, but what he said was that he finally started practicing this technique that I shared with him and that I'm going to tell you about here in a little bit. And he said, suddenly I'm like half as anxious as I have been for months. And the only thing he did different in that week between those sessions was he started practicing this particular technique that I had explained was pretty important to incorporate into his practices if his goal was to be less anxious, right? So this is one example. I've got countless times where I've seen this happen. So if people don't do this particular thing, do they get positive results? Yes. But if they incorporate to this thing, do they get better results? Hands down, 100% of the time, right? And let me tell you what it is, and I'll tell you why it works the way it works and is the way to actually reverse the anxiety spiral. So I mentioned earlier that when we get anxious, our stress level goes up. And when we get into code orange and code red, there are brain changes that occur that actually change the way we're perceiving and thinking about things and the way we mentally process things. And there are brain changes that don't really help in terms of coping. They help us if we're fighting off a giant bear or a saber-toothed tiger. They don't really help if we're dealing with, like, let's say, chronic relationship issues with your partner. They just don't. What they do is they actually turn your brain into a brain that works against you rather than for you. And so this technique that I teach is not only a technique that people can use in a transient way, like, okay, right now I'm anxious and I want to be less anxious. Can I do something to calm down? But more importantly, it's a technique that if you practice it the way I'm going to explain, it actually will recondition your stress response so that when you get triggered, you don't go as high on the scale. So instead of going to code red, you only go to code orange, or instead of going to code orange, you only go to code yellow. And also, when you spike up to that higher level of stress, you come down more quickly, right? Now, this is an invaluable benefit if our goal is to keep our brains from interfering with our attempts to respond effectively to triggers, and our goal is to turn around the anxiety spiral so that we're not maintaining our anxiety level or getting worse over time, right? Because we have this stress system that's just built into us. We're all hardwired to be anxious. And that can get hijacked by chronic anxiety so that we have too much anxiety too much of the time. And therefore, we're spending too much of the time in that state where our brain is changed into the anxious brain that's working against us rather than for us, right? So let's get to the so what. Let me tell you about what the technique is. The way to practice it is you do 3 things. Number 1, in a moment where you don't have to be on, so you're not on the phone and you're not driving and you're not talking to somebody and you're not actively working or writing email, but you can take a minute and just be with yourself. You relax your body. So do this with me as I explain it. So just relax your body. Feel your body in the chair that you're sitting in or the posture you're in if you're standing. You know the difference between tension and relaxation. So just let yourself relax a little bit. You don't have to be super, super relaxed and become a floppy noodle, but Just relax one notch, okay? The second thing is I want you to turn your attention to your breath. Every time you breathe in, your chest and belly move. Every time you breathe out, your chest and belly move. And we're going to watch that. Now, if tuning into your body and paying attention to the feelings in your body is causing your anxiety to get worse rather than keeping you calm, I want you to change and do alternate method B, okay? Which is put your hands in the prayer position, press your palms together, and pay attention to the feeling in your palms and your fingers, the place where your hands are touching, okay? That takes you out of the core of your body into the peripheral part of your nervous system, okay? So if paying attention to your breath makes you more anxious, then use the prayer position hand method until you practice a while so that you can go back to version A, which is pay attention to the breath and the body, okay? It's totally fine to do the hand thing. But if you can pay attention to the breath without getting more anxious, then just pay attention to the sensation in the body, what your body feels like when you breathe in and when you breathe out. And we're going to let the breath be natural. We're not going to breathe into a certain count or hold our breath or do anything special with the breath. So the first thing is relax. The second thing is tune into your breath. Let it be natural, but just pay attention to the movement of your breath. And if that's making you a lot more acutely anxious, then do the hand method. And then the third thing that we're going to do is every time you breathe in, I want you to silently to yourself, not out loud, but in your head, I want you to just say in. So the word in, however long you're breathing in, and however long you breathe out, silently in your head, just say the word out. So you're relaxed, you're paying attention to the breath, and inside your head, you're just naming the in phase, you're naming the out phase. If you get distracted and forget what you're doing, just go back to a relaxed in breath and say in with the next in breath. Go back to doing it, okay? If you do feel a little bit of tension or awkwardness or impatience arise, that's totally normal. That's not a failure. That's just what our brain does when we change the channel like this and we pay attention to something weird and new and simple. So just stay relaxed and breathe naturally and name the in phase and name the out phase. And what I prescribe with this is to do that for 1 minute. We're not going to do a big, long 40-minute practice session of meditation and mindful breathing. We just do that for 1 minute, okay? But we do that 5 to 7 times every single day. You can do more times, but don't do a lot more than 1 minute at a time, okay? And you can do this anywhere, sitting at your desk at work, lying in bed at night before you go to bed. You can do it while waiting for your lunch to heat up in the microwave or while you're stopped at a long traffic light when driving. But basically, anytime that you're still and you can be still and just focus on your breath and be mindful of the breath for a minute, you do that, okay? And I cannot tell you how many of my patients have supercharged their progress in getting desirable changes with their anxiety, regardless of the type of anxiety, regardless of what they're doing in the process, after they actually start doing this practice, right? And understandably, I teach this to a lot of people because it's so effective, it's so easy, and it so reliably produces good results. But understandably, a lot of people just don't do it, right? Some of you will watch this video and say, John sounds like he's full of shit. I don't get it. It's too simple. Can't work. I'm not going to do it. Some of you won't do this, okay? But I invite you, since it's such an easy thing to learn, an easy thing to practice, and it only takes a total of 5 to 7 minutes per day, right? I encourage you to consider experimenting with this practice. because I've gotten really good results with a lot of people, as in thousands of people at this point, just from that practice, no matter what else they're doing, right? Now, should you do other things other than this practice? Certainly. The wellness practices that I referred to earlier, those types of things are important. Potentially talking with your doctor and getting some medication might be useful as a component of your care plan. But regardless of the type of anxiety you have, regardless of what's triggering you, regardless of your status of low level, medium, or more severe anxiety, this technique is actually going to massage your brain and over time change the stress system so that your brain is more in the mode that's working for you and less often in the mode that's working against you, right? Now, part of the good news about this is that this technique only takes about a week for most people to get an unambiguous beneficial change that they can see how it's working for them, right? So that's good news, because the old school idea about mindful breathing and certain meditation practices was that you had to do a lot and you had to do it for a long time to get the results. But I can tell you, as someone who's been practicing for 27 years with this, and also before I became a therapist, I experimented with these types of things for 10 years. So I've got about 4 decades of experience now working with these techniques. And I can tell you that within about a week, most people get an unambiguous positive response. And if you experiment with this and you have questions about it, or you want to report on your response with your anxiety, feel free to come back and leave a comment below. You can go to if you don't want to leave a public comment and you want to say something to me privately, you can go to johnpeters.online and hit the contact button and send me a message there. But I guarantee this is going to work for you. It's the most reliable thing I know. I've taught it to thousands of people, and people often ignore it and don't get the response. But when people do this practice, 100% of people come back and tell me that it actually works really well for them, right? Now, it's not a magic cure. It's not the only component of working with your anxiety. But I do think it's an essential component if you want to get the most traction and get the most optimal result in changing your anxiety as quickly as possible. That's what I want to offer you here in this video today. So try it out, see how it works for you. And if you like this kind of content, hit the like button below. If you have yet to subscribe to my channel, please subscribe and stay tuned for future videos, because I'm going to keep making videos for the channel. And I'm glad you took the time to join me today. Thank you very much. I know that you have a lot to do with your time, and coming to join me here is sweet. So thanks for that, and I'll see you in a future video.